So I'm Emily Steventon. I'm a senior programme manager and I work for NHS England in the Midlands region, and I'm leading on a programme of work that's looking to implement a community stroke rehabilitation model. And NHS England, so they lead the National Health Service in England, and they're focused on overseeing the operation, improvement and transformation of healthcare services. So we refer to it probably more as quality improvement in the NHS, but definitely from the perspective of starting with quality improvement and then moving into continuous improvement. And there is lean thinking. I've always had an interest in improvement work, and I think that's why I started my early career in research. It's come into more focus for me more recently since I started the level 4 improvement practitioner apprenticeship, definitely. Then I picked it up in a quality improvement role while I was doing my apprenticeship. So I went into it with as much of an open mind as I could, I think. I was surprised, I think, by how structured it is, because in the NHS, we do obviously use quality improvement methodology, but it's kind of like it's a strand and it's been pulled from the original theory. So I found it really, really useful, really enlightening to get back to kind of, I suppose, the base theory of it all, because then obviously then you can understand why we've amended things in the NHS in our work. So I think my thinking's changed since being on the programme, and it's more kind of just always having a barometer to see improvement. And certainly, as much as possible, it's quite hard to access data sometimes in the NHS, is to look where data is and what it can tell us. And that's a definite impetus to do some improvement work. I found it really useful having the modules, I think, because you kind of build them, it's building blocks. And over time was good for me because it's see one, do one, teach one, in the sense that I can then directly apply it into the workplace. And then that learning is more iterative. So it was nice to build it gradually, I think. I think the key one is obviously the work-based project. So that was looking at a process in one team in my region where they're delivering an audit. That audit's really important because the data from it is what we use to do improvement efforts. So it was going back to that audit process, basically. And so I worked with a team and mapped their process, and they had this massive light bulb moment of, oh, okay, well, we do have a process, but it's not a very efficient one. And then applying all of the kind of the waste terminology and looking at, those opportunities for improvement. They wanted to go in and change so many things, but it was starting small. So through my work-based project, I looked at improving compliance on kind of one aspect of the audit. But what it's got on to do, I think, is then look at the whole process and then share with other teams, oh, well, have you looked at your process? Have you process mapped? So that was my key one, I think. In my wider work, obviously, I'm applying the methodologies in the projects that I support in my programme, and some of them are around process. I think for me, it's more the continuous improvement. So starting something and then what the iterative changes. So some of the PDSA cycles have come in really kind of to their own in the project work that we've been doing. So I think it's really strengthened what I've been doing in my jobs. It's worked both ways. I changed jobs because I wanted a job where I could apply it, and obviously they think they've got the best out of me because I've got this new, fresh knowledge kind of thing. So I think the most tangible examples come from these individual projects that make part of the programme that I'm delivering. So in my specialist area, I've said it's involved streamlining processes, and that's led to things like reduced waiting times for patients who are waiting to receive stroke rehabilitation therapy, and that's a really big deal. Some of it's around better use of resources, and through implementing digital technologies, it's releasing staff time to care where they were doing administrative work. So there's real kind of patient experience things that we can see have changed. The other thing for me as well is that it's so rewarding when I hear from the teams that I've been working with and sharing this knowledge. So I'm building their capabilities around quality improvement through the projects that they're running, that they can see the improvements in their services. Some of it's data driven, some of it's a bit more anecdotal, but they are getting feedback from their patients that the experience is good. And even better, they think, oh, what are we going to do next? So they're starting to kind of catch on with the continuous improvement bit of it. So I was really lucky. I changed jobs but I changed jobs deliberately because I wanted to be in a job where I knew I could actually apply the knowledge. So I think for me, it was my top tip would be go and talk to the people you work with and say, I'm thinking of doing this. And knowing that you're going to be doing a work-based project, go like have an early conversation and figure out what things do we have challenges, things, what might we want to improve, because you're going to need to commit to that over the period of time of the project when you're doing the apprenticeship. And I think having the support of your team to do that makes it a lot easier to release you to do the module work, because you're giving back to your team by doing that piece of work. So who's influenced me the most? So I always like to catch up on the latest thoughts of a lady called Helen Bevan. So she's a prominent figure in the field of healthcare improvement and leadership. She inspires me because she advocates for continuous improvement in the NHS. She's always sharing insights on X or Twitter, and her ability to communicate complex ideas with clarity and passion inspires me to do the same when I'm doing my improvement work. And I guess she inspires me to inspire others. I've also recently started looking into compassionate leadership, and this is a really big thing in the NHS at the moment, and how it can help us to implement change. So I've been inspired by a gentleman called Professor Michael West, who tells us that we need to embrace teamwork and an inclusive culture to achieve better services and outcomes for patients. And that's all kind of part and parcel, I think, with the continuous improvement methodology as well.